Dr. Cijith Sreedhar is going to speak about importance and role of responsible wellness tourism post-COVID. Dr. Cijith, he's a BNYS graduate from JSS INYS Coimbatore. He comes with a rich experience of 14 years in holistic healing and believes that as a doctor, it is his duty to teach his patients on how body heals itself. Like we know the cardinal principle of naturopathy, nature alone heals, and how it does when exposed to a conducive environment. He also is an internationally certified NLP practitioner who strongly believes that one's thoughts and values make a man, and therefore he incorporates mind modification as a powerful tool in healing. He is presently the Chief Medical Officer of Prakriti Shakti, that is a clinic of natural medicine by CGH Earth, and has been in this role for 3 years. So over to you, Dr. Cijith.
Thank you. Namaste all. As Dr. Abhishek Jain told, today's my topic is the role and importance of responsible tourism in post-COVID. What does that responsible means? There are two responsibility comes there. One, our responsibility to the environment and our responsibility towards ourselves. These are the two important areas which gain prime importance in the post-COVID time. So why this change happens? What is the importance? Because now the entire population, the entire globe is in a aha moment of realization of many things. But majorly, one is money is not equal to health. Are you living in a rich country? Are you personally wealthy? Doesn't make any difference in are you going to live or are you going to die. Two, pills are not saviors. The medicines are not going to help you. You should look beyond to keep yourself healthy. Third is shortcuts won't work. These are the three important realizations one should have who clearly observe the changes or the learnings of the COVID time. And in this, the third point is very important. Shortcuts won't work. We know that if you look into the online platforms and articles coming out of this time, lot of talks around, focus still on shortcuts. We can see plenty of informations, false informations falling in from the different part of the world, advising for shortcuts, which says that a piece of ginger or a piece of lemon or a piece of garlic, whatever it may be, can help you to boost your immunity. Even though the COVID time proved that reducing a sugar with the help of a chemical pill or a herbal pill is not actually treatment of diabetes. Because even though your sugar levels might be normal, won't make any difference. If you are not actually taken away the root cause of the disease, you may die. And I say it is not death, you may commit suicide. The death because of any lifestyle disorder is actually, I say, is suicide, because you are not controlling the factor which can prevent your death. It is important to tell loud to the world that the symptomatic management is not going to help. You should be responsible for your behavior. This is going to only the way out which can help you. When people comes to our wellness places before, it is sorry to say, but most of the times the target was to feed their ego. It is not important what they actually get from that place. If they are looked after well, if the place was beautiful, and if their small egoistic need was satisfied, we may get a good rating and they may go back happily. But now this is the time to change. Now we should start feeding their intellect. How they go back from us is not important. How they live after going back from us is important. If a person go back looking healthy, and getting diseased in such kind of conditions, then it affects our credibility. But if we use the time there with us is to teach them how to maintain their health, even at this condition of at this time of threat, is actually make the difference. Then the main thing is making them responsible of their health. Most of the part of the world, even in India, the wellness tourism were working in a model like come to us, stay with us for a few days, detoxify yourself, go back and live as you want and come back to us. No, that mantra is not going to work because these conditions may repeat. It may be COVID or some other thing, but it may happen, repeat anytime. People may not able to come back to us in a particular time. So this is important, that how we teach them to maintain their health even after they go back is important. Is giving the responsibility back to them. Like you come to us, we take care of you, not going to work. And giving them in plenty, again, that not going to work. The law of minimum and conservation of energy, one of the basic concepts in naturopathy, has got a high value now. Because the resources are limited. It's not plenty is not equal to quality. Giving them small, minor, important tips which can take back and practice is important. We should teach them how the simple things actually works more than bigger, valuable things. Health is a self-sustainable, self-responsible practice now. When you looked into this responsibility, three things, again, we have to think. One, the global habit versus the personal habit. If we know that, if you think back, when there is a Ebola breakout in Africa in 2017 around, we are not actually not worried about that. We think it is in Africa, why we should worry? When we read in an article about a eating habit or a living habit of a people in China, we must not worry, like even for this COVID, when we heard that first there is an outbreak of an infection disease in Wuhan, we actually didn't worry about that. We thought, okay, it is in Wuhan, kilometers and kilometers away from us, why we should worry about that? But now we first a scenario, a situation which says that the global habits really matters. It's not only how personally we behave, the global habit really behaves. It's a time to say loud that the behavior of the entire globe is very important, then come back to the personal habits. We should say clearly to our clients or patients or guests, whatever we call them, that you are not going to get cured with any pills. It is simply because you are not getting a disease because you are not taking any medicine. One may get diabetic or hypertensive or anything, any cardiac disease, is because they didn't sleep well, they didn't eat well, or they didn't do their activity well. And the medicine is not a solution for that. The personal behaviors really matters. Second, the global environment versus the personal internal environment. It's not that how we keep our home hygienic. The environment of the entire globe is very important. Any disruption in the environment in any part of the world will have a huge impact in our health. We should take care of the global thing like a pollution. It's like a pollution in China or Africa or in Brazil is actually important for us sitting in India. It's going to affect us. It may lead to a genetic mutation of a small virus anywhere. Long go the internal environment. How we are keeping our internal environment not open for the growth of disease is important. And even it's very unfortunate that even in this time of COVID, this is not getting importance. Still, the entire globe is waiting for a vaccine or a medicine to come and save them. It's not a naturopathic view, but the WHO have clearly stated that the infectious disease is a combination of three things: a host, a environment, and a agent. Even our practices are still focusing on the agent, like how to kill the agent. We are not focusing, we are not telling the world that focus on the environment, take responsibility of the environment. The practices which you down, like a hand washing or a social distances, are aiming a small percentage of the environment. And the most unfortunate part is the third part, a healthy host is completely neglected. If you are keeping some practices focusing on the COVID, you are going to get something else in few coming years or months. Again, you have to go for a lockdown. But if you keep your health, if you take responsibility of your health, you don't have to worry what comes for you. You are ready to face them. So the thought process, it's we as a wellness, as the responsible person in the wellness industry, how to say loud that it's your responsibility, no one can going to help you. The environment and your health, which is not open for the growth of any diseases, is very important. And next is the global resources and your personal resources. What resources we have globally to manage such condition is important. Now we have seen that a medicine which made in India as exported to different part of the world, it became a global resources. So we should be aware what resource available in globally to help them, and what resources you have personally have to maintain your health. The money you have is not a resources anymore. The practices, the health habits you have is a major resources. We have seen that surge in the demand for the online platforms, which is not going to be a threat for the wellness destinations. It may be a demand for a momentary thing, but people are going to come back to the centers simply because an online platform cannot hug you. An online platform cannot pat you at the back, and it cannot give you a genuine smile. And that is what actually people need them. And the most important insight learning from this, the told again and again WHO definition, like health is physical, mental, physical, spiritual well-being, is not more relevant. It's a time to redefine the health as the ability to adapt and self-manage. Can you adapt with the changes in the world? And can you manage yourself? So this message has to be taken across the borders. And another thing is stress. When we come for the responsibility towards the environment, that actually really matters. Because when we used to speak, we remember, like if we need to remember, when we speak with our patients earlier, they said that they are stressed because of work. They are stressed because lack of time. They used to say they have no time to do exercise, or they have no time to eat healthy. But this lockdown period gave ample time for everyone to sit at home, to practice exercise, to eat healthy, and sleep on time. But now you go for feedback. Most of the people were more stressed than they were at work. Because stress, and it's again time to redefine the stress as a response to the stimulus from the environment. You may get a various kind of stress factors from outside. We should speak to our clients or patients like this make no difference. You may get a stress. How equipped you are in your thought process and in your biological sense to change that and to defend that is important. And other last factor is genetics. The genetic factors. People used to come and tell us, many of the doctors here that have heard many times that I'm diabetic, but I cannot help it because my father was also diabetic. The diabetes run in my family. No, diabetes won't run in your family. The bad living habits run in your family. Genetical factors may decide what disease you should get, but the why of the disease is not decided by genetic factors. It is decided by epigenetic factors which modify your genes. Again, coming back to a lifestyle, like what you eat, which environment you live, which air you breathe, and how is the nutritional status and how you manage your stress. The epigenetic factors really matters. The the messages, the message which go loud in this scenario is the nature have everything which to satisfy your need, but not your greed. There is no shortcut. Let me summarize what I said now. There is no shortcut to health. The every factors, I say it is 7 factors: the diet, the activity, the sleep, the environment, the microbes, the mind, and the rhythm. Equally carries the importance in making you healthy. And no doctors, no hospitals, no research activities, no vaccines can save you. The responsibility is yours. So what is the role? The role is telling this loud to the people around you. And what is important is a time which proven to the world that everything which believed to effective is failed. So this is the role and this is the importance of responsible wellness places. And I think this is a time to rename even the word wellness. There is no more wellness. Wellness is actually external. It is actually the healing tourism. Is actually making you healthy tourism. Wellness is a feeling and being healthy is a state. Getting cured is a process. So we should look beyond that, a small limited area of wellness, to actually speaking about health, getting healed and cured. And this is the time which defines, are you going to live or are you going to die? There is no saviors coming to there, no pills, no vaccines, no medicines. It's us. So we have a huge responsibility and a huge scope. The question remains is, are you equipped and are you ready to give what the world demands now? Thank you.
Thank you so much, Dr. Cijith. Appreciate your passion, and I know it was like an extempore speech. We could make out that you speak a lot from your heart and with real knowledge, so really appreciate that.